Good afternoon, everyone. Thank you for joining us for our QTECH Committee monthly meeting. We will be starting in a few minutes. It's about 2:58 right now, so let's give it a few minutes. I see people logging in. Thank you.
Good afternoon, everyone. Thank you for joining us. We see we've still got some folks logging in. We'll be getting started in just a minute.
Good afternoon to you as well.
Thank you.
Good afternoon. Thank you. I wanted to do a quick sound check. If others in the chat can hear us, at least give us a yes, or you can also unmute yourself. We will be allowing you all to unmute yourself to speak throughout the meeting.
Yes, can hear well.
Thank you.
All right. Well, thank you, everyone. We greatly appreciate you taking the time out of your busy schedules to join us this month for our monthly QTECH committee meeting. We have some hopefully very timely and relevant topics for you all as we continue to look at ways to support you as we respond to this pandemic that's impacting our communities. So thank you, each of you, for being here today. As we take a look at our agenda, just a quick overview. We're going to be diving into, hopefully many of you have been able to attend the weekly webinars that HCN has been co-hosting with the Alliance of Chicago under Dr. Tim Long, our Chief Clinical Officer's leadership. We are continuing. We've had 5 webinar sessions. Stephanie Smith on our team is going to spend some time to go over some highlights for those of you who weren't able to attend, but we are very much committed to continuing these webinars as the need is there. I just want to do a quick shout out to many of our centers on the phone today. You all have led the charge and responded and participated in some of these sessions, so we greatly, appreciate your time, your expertise, and your willingness to share what you're doing, how you're tailoring your operations and responding, not only with our centers, but with health centers across the country. So many thanks to Community Health Centers of Pinellas, Commonwealth Health, Jesse Trice Community Health Center, Found Care, Family Care Health Centers of St. Louis, Miami Beach Community Health Centers, West Hawaii Community Health Centers, and Salud para la Gente. I hope I covered everyone there. We want to hear what you're doing. We want to hear what your challenges are and what we can do to better support you. I think facilitating those discussions are really important right now as we work together to support our communities. So from our team to yours, thank you very much. From there, we will be, while we know our centers are not immediately focused on UDS, there are some key considerations that we want to start dropping and making sure you're keeping in mind as we move forward over the next several months. At HCN, our team is keeping a pulse what's happening from HRSA, but also how we can help ensure we're continuing the right conversations with you. From there, we're going to dive into some telehealth strategies. Our Chief Information Security Office is going to be providing you an update on some very important cybersecurity tips. As many of us are adopting telehealth platforms, hopefully you all are aware, unfortunately, of some of the threats that are coming down the pipe. So we will hear from our experts in that arena, and then hearing from our training technical assistance team on just some key areas and considerations moving forward. So with that, I'm going to pass it on to our team to speak to you. Please, as we go through this presentation, please feel free to utilize the chat option. We do want to hear next interesting topics and so forth. Also, thank you. On the next slide, a quick reminder, HRSA has reached out to us as of yesterday to do a friendly reminder. Margarita Lett should have sent an email out to your C-suites earlier today, but just a quick reminder, there is a deadline this evening at 11:59 for the COVID funding activity and budget info requirement. So that is due today at 11:59. I think they're a little concerned about the amount of responses they've gotten this far. So just a quick highlight for you there to pass on to your teams. And with that, I'm going to pass it on to Stephanie Smith. Thank you very much.
Hi, everyone. Good afternoon. Thank you for joining us today for the QTECH meeting. As Meredith mentioned, I do plan on going over some of the key takeaways from each of the 5 sessions that we've had thus far focused on COVID-19. So on this slide, we're covering session number 1. So session number 1 was really at the forefront of the COVID-19 pandemic. So we wanted to have a chance to get some national partners as well as some of our health centers together in order to share what they were doing in response to the very, very beginnings of COVID-19. So I have the presenters listed on the left-hand side, and I'm also having the marketing material within the section in the middle. But I plan just to get everyone to look on the right-hand side just to see some key takeaways within different sections of the webinar number 1. So for webinar number 1, we had our CMO from National Association of Community Health Centers provide some insights from his perspective to the group. He did provide some really helpful information in terms of making sure that you have an opportunity to partner with local organizations in order to access some additional PPE resources. And something interesting to note is he had even mentioned reaching out to construction organizations as well as some private dental offices as other areas of opportunity to seek PPEs. So that's just some highlights from the PPE section. Staff education was also a key takeaway that our health centers had presented during this session. So they spent a lot of time talking about how they prepared their staff to respond to COVID-19, whether it was virtual care trainings in terms of how they were going to use the new tools and technology as the rapid uptake of telehealth was occurring, to even looking at PPEs again, what's the proper way of donning and doffing those PPEs. And of course, as most important, it would be the CDC and any sort of local guidance that was available at that point in time to prepare their staff for COVID-19. Some interesting points to note for staff communication. So some interesting things our health centers did as well were establishing their own communication lines. Something to note was a COVID-19 task force that one of our health centers was able to give some insight into. They also decided to create an FAQ, and I think that goes along with the additional bullet point there. They were trying to make sense of all the noise, which I think is still key information and a key takeaway even in today's situation, just knowing that as the leadership of the organization of your health centers, keeping all of that information that's out there, whether it's the media, Florida Department of Health, or just your local Department of Health, and making sense of the information so that you're better able to equip your staff to respond to the crisis. Within the patient care section, at the very beginning, our health centers were already thinking outside the box of ways to respond to COVID-19 and how their operations would change in response to that. So some of the key things we have here to mention were triaging patients before they came into the health center to minimize that exposure. So whether there was a process on the phone, or even right outside of the facilities, just to make sure that there was a way to minimize that. A lot of health centers were also already starting to look at their schedules and looking at the visits that could be converted to telehealth and figuring that piece out. Something interesting to know with regards to the drive-through testing for session 1 includes making a phone line or a phone bank. So having a direct line for patients to kind of reach out for that service was something interesting to note. And also, in terms of the drive-through testing, having a connection with your lab representatives was also key in that process, and that was something that was shared. So making sure that you have the key patient demographics that you needed to get the lab process, and also, if possible, register as part of the health center. So a quote I have there is just something that I took away as just one quote for that session was working in the now, which I think still rings true today. Next slide, please. Perfect. So for session 2, we tried to dive in a little bit deeper in terms of telehealth and what technologies and what workflows were health centers having in place in order to respond to COVID-19 and change up those operations to include telehealth. As you can see on the left-hand side, we had many of our other fellow partners and health centers from the Alliance Chicago area who actually helped to present during session 2. And I think the key takeaway as I go through the items that you see on the right is the whole intention was making that telehealth experience try to feel as same as if it was in person, as much as possible for your patients. So in terms of the telehealth platforms and technology, you can see the different ones that are listed on the slide that each of the different presenters had presented on and specific to the session. But then they tried to also mention some other technology or tactics, things such as headsets, making sure that staff had the equipment that they needed in terms of using telehealth. They also mentioned really interesting things to get both their patients and their staff engaged in the process. So they actually had a health center who created a telehealth guide just for their patients, and also a version of that, a toolkit that was for their staff, so that both the staff and patients were informed on the new processes that would be involved. Another thing that was noted is some health centers found that if for whatever reason during a prep visit, the technologies may not have been working as ideally, they were able to quickly move to a telephone visit. Of course, that is a last resort in terms of the visit, but that was another option that they shared. And of course, regardless of the tools that were presented or used, they all made it known that it has to be part of the workflows. It has to be ingrained, and the consistency is key so that everyone at the health center is on the same page in terms of the technology and the processes in place. For clinical operations, we noticed that a lot of the health centers shared that behavioral health teams really made that first push to telehealth in terms of trying out those forms of visits, which was very interesting. They also continued to review their schedules to make sure they were converting appointments to telehealth as much as possible, and even tried to start thinking about ways to make a hybrid visit. So essentially, what part of the visit could be done virtually using telehealth, and then maybe potentially for a very short period of time in person for other needs a patient might have. And I think one of the biggest key things in clinical operations that was shared amongst the group is that clinical support staff are key to this process. They play a very big role. So whether it's your MAs, your nurses, or even your front desk staff, having them play a part in the process and making sure that you're verifying contact information for patients, kind of letting patients know some telehealth etiquette, making sure you're in a private space, what to expect of that visit and how it's going to be a little bit different because it's virtual. Another thing that they covered were screenings, which I know that Haru later on in our presentation today will touch on that. But what are some key screenings that your clinical support staff does today at the health center that could also be done in a virtual manner? We also saw health centers sharing how they changed up their staff. So finding ways to use staff in unique ways to help support operations as well. There's some clinical content included here. Some people use paper forms for the drive-through testing because they felt that that helped their process a little bit easier. And then, of course, within our COVID-19 resources, we had Jillian, who will be speaking with us today, from HCN, share some of the telehealth software resource guides that we had, as well as Jen, who is from the Alliance Chicago, our sister health network, and she presented on some of the 1135 waivers, as well as some other telehealth national resources. Perfect. So session three. Session three was a continuation of telehealth, but looking more so at certain populations. So in terms of adult medicine, OBGYN or well women visits as examples. So pediatrics was another example that we touched on. And as I go through these slides, I know that these are just high-level topics. I really recommend that everyone has a chance to just check these recordings out after this meeting and really listen in detail if you want to hear more. So for session three was telehealth. And some interesting things to note were how our health centers were using text messaging technologies, such as Care Message that we have listed here, to send out mass text messages to keep patients informed of how they were meant to access care at, now in this setting. So they were letting every patient know through these mediums that give us a call first. Try not to just show in person if possible, so that they were able to do that triage and minimize exposure. So other things to note within the technology section, some of the technology had some bugs. So for whatever reason, if they switch from selfie to rear, keep those things in mind as you go through, because those are things that might impact the patient experience. Okay, so that covers the telehealth platforms and technology, which, as we mentioned, these different tools, these are just tools that were shared during the presentation, and that's just why we have them listed here. Clinical operations, so again, looking at hybrid well visits. So how can you have patients come in person quickly, whether it's for vaccines or other injections or labs that patient might need? Also, a lot of our health centers shared that they use this time to catch up on any sort of follow-up care, looking at their schedules once again and seeing were there patients that they had to follow up for certain ADHD, asthma, just as some examples. For patient care, there was a lot of discussion on, again, how can, when patients are coming into our facilities for labs or vaccines or anything like that, what are ways that we can help minimize their exposure as well? You know, suggesting they come in during low volume times, or designating certain entrances that were only for those patients were other examples. And there was also great insight into patient care in regards to how video component and how important that video component really is for the virtual visit to capture some of those physical elements, so physical exam elements, and also even some infant developmental milestones. So I suggest that you check out those recordings to hear some of the details and some of the insights that providers have given in terms of what you can capture using video. So next slide, please. Perfect. So session number 4. So session number 4, we took a different route. So we actually wanted to focus back at the workforce. So what are some techniques that our health centers have in place to sustain the workforce and kind of keep staff engaged and involved in the process of COVID-19 and how it's changing? So in terms of staff communication, some of the examples we have listed here include 24-hour communication cycles. So finding ways in your operations to have a touch point with your key teams to make sure along the way the message of what the current status is and what's going on at the health center is disseminated across the organization. So that was a unique thing that was offered. Another one was actually keeping lines of communication open with furloughed staff. So one of our health centers, Commonwealth Health, had actually shared how they were keeping a communication with those folks, getting their personal emails and contact information, and even in some cases including letters or cards that they could send out to those teams just to let them know that they were still in their minds. So those were very unique cases. Also within staff engagement, that was another really key point. Something that was mentioned was the importance of that, because if they're engaged from the get-go, even during these kind of pandemic times, it's very essential so that they're able to kind of hit the ground running in these cases. Fun things, though, that were mentioned were things like offering boxed lunches for any employees that were actually working on site. And then other additional things included a scavenger hunt. So one health center in particular was offering a scavenger hunt to their employees, and it was a way for them to navigate the intranet and areas where they get key information that they needed. And if they were to follow through with that, there were some prizes at the end. So that was something very interesting. Another focus for staff engagement was self-care and also virtual wellness opportunities. A lot of the health centers shared how they're using even their own internal behavioral health staff to create these forums that allow staff to come together and kind of talk about their experiences and ways to kind of continue being resilient in these times. For clinical operations, we keep hearing about, as well, alternative work assignments. There may be staff that you repurpose in certain ways. I remember hearing CHCP mention how they have actual medical assistants that were working in the call center. That was something unique that they tried to do because they wanted to ensure that there was a clinical trained person on the phone available because of the influx of the amount of questions that were coming in regards to COVID-19 and what patients should be doing. There's also a consolidation of health center sites and hours. So that was something that they decided out of all the sites, some would be designated just for well visits, some would be designated just for acute visits. So that was a conversation that a lot of our health centers had. In terms of resources, we actually had an opportunity with a partner of ours through National Association of Community Health Centers, the Coleman Associates Group, who has a document that's included in our COVID-19 resource library that speaks to reduced workflows and staffing guidance for non-clinical operations that has a decision tree and some other really helpful information. Next slide, please. So session number 5. So this was the latest session that actually took place yesterday, and its focus was on special populations. So the really key takeaways were there is an existing gap in terms of national data for race and ethnicity of COVID-19 cases. Just today, as we talked about HRSA with their survey, and during the Flattening the Curve series for NAC that just happened a couple hours ago before this meeting, they mentioned how HRSA will be asking for race and ethnicity level data on these COVID-19 situations so that they can have a pulse at a national level on the impact even further. And I think another key point was social determinant of health collection is as important as ever right now. One of the recommendations our centers had was to advocate with your local Department of Health on the importance of capturing this data and how much that information is needed to see the true impact of COVID-19 across these different populations. In terms of tactics for special populations, we have some listed here. Some folks were talking about how contactless delivery or pickup of drive-up or pickup of food was an option for homeless populations. Even in homeless populations, some of our centers mentioned the providing of hotspots or other tools so that their patients could still access the health center through those virtual visits. Also, some walk-up testing opportunities was another option. And then in terms of elderly patients, they actually mentioned the need to support those groups as well in general in this transition to virtual visits. Next slide. Perfect. So I just want to stop here and say thank you to all of the partners and all of our health centers that have been engaged in this process and sharing their story with other health centers on a national level. I think this is something so important right now to hear from everybody and see that what's going on out there. How can we learn from each other and make it through this process together? So thank you so much for participating and sharing that story. We have all of our recordings of these presentations listed here. So check that out in our presentation. There'll be an actual link so that you can see all of the different recordings at your leisure and have a chance to really dissect the session of your choice that you'd like to hear further on. So thank you. And without further ado, I'll pass it on now to Haru, who will talk about the impact to UDS reporting and COVID-19.
Hey, good afternoon, everyone. So we heard a lot of very informative stuff from the webinars that Stephanie just summarized for us. And a lot of what I'm going to talk about, I mean, we can get a lot of resources for ideas from those webinar presentations. So if we go to the next slide, I mean, we're just stating the obvious, the impact on UDS. We know there's going to be an impact. There's going to be impact on patient and encounter volumes. A lot of you are seeing reduction in your patient volumes. Looking at the numbers, some of you are creeping back up again, making use of telehealth visits. So we want to talk a little bit about that. Obviously, patient encounters is going to affect patient revenue. And of course, the other one that we worry about is clinical measures. Now, we haven't really heard any guidance from HRSA as of yet as to, you know, their thinking on quality measures. What we do know is that in terms of the quality improvement awards that we always look forward to in the summer, that is not going to be affected for this year. So your awards that are going to be given out in summer of 2020 are all going to be based on your 2019 UDS. So while they have not said what they're going to do, I mean, it is our expectation, and we've kind of heard that they're looking at it, that they will adjust their QIA awards for next year to be a realistic measure of what could be accomplished or what can be accomplished under the circumstances that we are in. So having said that, you know, what can we do? What can we do to mitigate some of these effects of COVID-19 emergency on our UDS reports? So obviously we've talked a lot about it. The first and foremost, next slide please, is ramping up our telehealth capabilities. And I do want this to be kind of a interactive session. So I'm going to ask for people to jump in. Telehealth visits are now UDS countable, which is fantastic. They just started that last year for the first time. So how nice that it's already included in there. We also have some relaxed rules right now that have been placed during the COVID-19 emergency. And I put in the link there that kind of describes some of these relaxed rules for using telehealth during the COVID-19 emergency. So definitely we want to make sure that we are maximizing our use of telehealth visits. There are also new funding opportunities. As part of the CARES Act that was released, there's $200 million that the FCC is making available for centers, for entities, including FQHCs. And, we'll talk a little bit about that also. And I may call on, I know one of our centers has just received it, so if you're on, I might ask you to talk up. And then we, again, learning from each other. We have the webinar series that we just went over, the 5 webinar series behind us that we've gotten a lot of information from. There's a HRSA telehealth webinar series. And I also wanted to point out this high-tech resource that just came out on, kind of developing telehealth workflows and such. So I wanted to kind of open it up to people to share. We've had a month. I know we talked about this last month, where, what are you guys doing in terms of telehealth? And I wanted to open it up now. We've had a month now behind us. So a lot has happened. This is something new, and we are learning as we go along. So I just wanted to have an opportunity for you guys now to, anything new that has happened, any particular workflow that has worked well for you, any equipment that has worked well for you. So if you could open it up and ask some of you to kind of let us know how you're doing with telehealth, what is working well, what are the challenges, and what we can do to assist you.
So all attendees are unmuted right now, so if you'd like, you can speak up now.
This is the best way for us to learn from each other.
Muted.
Hello?
Hello?
Hi, this is Ashley from Baringan. And we're doing telehealth calls. We're reaching out to patients. We ran reports on our asthmatic patients, our ADHD patients, patients with chronic comorbidities. Those patients who
they're talking about it.
We want to stay away from the clinic, and we've been reaching out to them, so that has been successful. One of the things that we've discussed, we haven't implemented it yet, but we've discussed doing drive-by A1Cs to help at least with the A1C measure. So that's something we want to start next week. Scheduling patients spaced out, outside, just like how we're doing with the testing, and do the drive-by A1Cs.
Great.
So hopefully by the time we have our next call, we'd be able to provide you guys with some feedback on that. But that's something that we want to starting next week.
Great. How are patients reacting to the telehealth visits? How are you convincing patients to get on these calls?
We basically let
anybody who's not talking at this time to please mute yourselves. Just unmute yourselves if you're talking. Okay. Go ahead.
Yeah, we basically let the patients know that due to the coronavirus pandemic, and for their safety, we'd rather them not come to the clinic, and their provider would like to speak to them or have a video call with them remotely. and we let them know that they are still, you know, if it's medications that they need, we'll get their medications mailed to them. Anything that they need, we'll try to provide it to them remotely. Even with regards to medical records, mailing those out. So that's sort of like the script that we've been using with the patients, letting them know it's for their safety. And they're happy with the telehealth calls. A lot of our patients are consenting to the telehealth calls, and we started Cure for You, which is our new solution for video calls. So that's something that we've been piloting with a couple of our providers, and our providers are happy and the patients are successful. Actually, we wanted to start telehealth before COVID, and it kind of sped up the process, and our providers are happy, and now everyone is doing telehealth. So at least when this all dies down, we won't have an issue with, you know, trying to get the providers on board with telehealth. So that's pretty much how we've been doing it. Our EHR system, Athena, allows us to prep the encounter before the day before. So we're able to call the patient the day before, ascertain as much information as we can, and have that sort of like be on hold within the encounter, and it's activated once the patient is checked in. Any self-reported vitals, we document in the notes section of the vitals section. So if the patient is diabetic, we ask them to take their blood sugar levels. If the patient is hypertensive, we ask them what their self rating was, and we document that in the chart. And of course, we ask them about pain. So those are that's pretty much what we've been doing so far.
Okay, great. Is anybody having challenges with getting their patients to consent to using telehealth?
This is Caitlin in St. Louis. I would say that our patients are also feeling enthusiastic about the telehealth, but the challenge that we've had is that with providers that are doing telehealth when they're at the clinic and when the patients are at home, there's like a bandwidth problem. And so the video is often choppy and providers end up having to just do a phone call. And also, there is sometimes like technology problems on the patient's end where they like aren't tech savvy enough to figure out how to get on a video for full telehealth. So what I have been hearing is that a lot of our providers most of the time are having to just either briefly do a video and then finish the visit just on the phone, or just doing the whole thing on the phone.
Okay. So I actually just saw something this morning where there was a center that had, I don't know if it's a particular center, I think, had put together a short video. It's about a 2-minute video that they're sending to their patients that kind of walks them through how they're going to be receiving the information, where they need to click, what they need to do in order to get on a telehealth visit. And I thought that was really neat. So maybe that's something to look into.
DoxyMe has a video like that, and we posted it on our website. And so now that, but we just put it up earlier this week. So now a link to that page on our website is going to all the patients and their appointment reminders that they have a telehealth appointment. And when operations calls patients, they are reminding them that they can look at the website if they have problems. So hopefully that will help, but that's a great idea.
Yeah, well, that's great. So everybody who's using DoxyMe, keep that in mind. And are any of the other platforms that anybody is using, does any of the other platforms have something similar? I know some of you are using other platforms. No? Okay.
Haru, if I could, I do have one thing that I think we haven't really tackled yet because this telehealth thing came about so fast, is that I think that a lot of our providers have not been doing the PHQ 2/9, and I am curious about how that's working via telehealth at other centers, and if they have their MAs like call the patients beforehand, or just how that's working, so we could start trying to get those done again.
Okay, so we were going to get to that. I have a slide on, let's talk about the things that we can do on telehealth. So I'll ask that question in a minute, because definitely we want to know how people have been tackling that. There are certain things, that we can do during a telehealth visit that will definitely mitigate the impact on our clinical measures, and that's one of them: depression screening. There's tobacco screening, and then some of the medication-related ones. So let's just hold that thought for a minute and see if there's anything else that we can share on actually the actual telehealth piece of it.
This is Felicia. Can you hear me?
Yes, we can, Felicia. Go ahead.
Okay, sorry, I was trying to talk earlier. We had the same problem with our patients getting connected, navigating their settings or their app settings to enable microphone and audio. And we are utilizing our care coordination team, because now, it's been a shift in patients in office and doing the scrubbing and education. So we're having them call a day ahead of time and making sure that the patients can connect and doing any of that pre-visit type stuff at that time. And then we're actually using the care program in Entergy to indicate that they are telehealth ready, so that when the MA goes to connect with the patient and get them in the waiting room, they know that this patient has already had all that done and they're going to be ready to go.
That's an excellent idea, because yes, we've had to repurpose some of our staff, and that's a very good way to use them, because this is not going away with COVID. I think telehealth is definitely here to stay. And I just wanted to ask, I've been hearing some providers that are saying that they're actually more efficient, are able to see more patients. Is anybody able to speak on that that's on the call?
For our providers, we have a couple that really love it. I think the issue is our scheduling, and if they have back-to-back telehealth, it works great, but we still have patients coming in to our office. Probably 70% of our visits are still in person, and our providers are only at about 30% telehealth. So when it's a telehealth and inpatient in office, that really slows them down. But when it's telehealth back to back, they have said that, they can just breeze through it. It is very efficient for them. And patients love it.
Felicia, I had a quick question for you. This is Stephanie Martinez. For your telehealth, are you changing your hours? What about your telehealth office hours? Are they during regular patient scheduled times, or is this happening on off hours or off days? Have you created a new schedule?
No, we haven't. We are waiting to get the providers more comfortable with it before we change schedule. We're still same schedule.
Okay, thank you.
So one of the things that we've also heard is, scheduling providers to work alternatingly from home doing telehealth, and then at the site doing on-site care, where they have different schedules where they might do 2 weeks from home and then 2 weeks at the center. I think that has worked well for some centers. Anybody else want to share on? Yeah.
You do have a comment in the chat that says, I am unfamiliar with the feature that was mentioned in Entergy to identify the patient was telehealth ready. Could you elaborate? And that message came from Sarah.
So I think that
I'm sorry.
Go ahead.
Oh, I was going to say that's the care program feature in the EHR, where we identify different groups of patients that say pediatric behavioral health or trauma-informed care or our pre-diabetes, and you can report on that field. It's a care program, and it's user-defined setup where you would create those.
And we can
Does
you know,
that
reach
help?
out and follow up. We can reach out after this call with our staff that can probably help you a little bit more with that feature.
The only other comment I did get in the chat was in reference to some of the struggle, which was, hold on, my screen just jumped. That was our patient population is one that frequently have government-funded cell phone plans. Many of them are declining video telehealth due to concerns over data usage. And that came from Emily.
Okay. All right. Have all of you, I mean, you may not know, but I'm hoping that all of you have applied for this FCC funding for the telehealth program. Is anybody on the call from Banyan?
We do have some Banyan folks. I did unmute. You are open to speak if you'd like to.
Just wanted we did see that announcement, so we just wanted to see, you know, any pointers on the application process. You know, what does a winning application look like?
And congratulations, by the way.
Absolutely. All right. So if you are not able to speak on it, that's fine. But I do want to encourage everybody to make sure that you are applying. This is, you know, we can use this funding for equipment. And talking about equipment, I know that we've had some, you know, and Stephanie alluded to it also, best, you know, what's best for the providers. And we've heard about, you know, if possible, having two screens is really helpful, where they can see the patient on the one screen and document on the other. So these are things to keep in mind when we're looking at our, you know, what are we going to, you know, what are we going to ask for? What are we going to use this money for? And definitely having headsets and such. Anybody want to speak to, you know, how you're using your equipment? What works best for you?
Hi, this is Brenda from Broward.
Yes, hi, go ahead.
So what we're doing is at first we started with a double screen, and then we found that the providers were feeling like they weren't really making that connection with the patient. So we got some spare tablets that we had, and we connected them that way. One of the things we do is we have the MAs prep the visit before, like they'll link the patient up and have them ready. They'll do all the pre-stuff that needs to be done, and then they'll hand over the tablet to the provider. So that kind of helps the process, and it's like a little buffer before the provider actually gets involved with the patient. So that kind of helps out for us.
Anything else that anybody wants to share on telehealth visits? What you found helps, that makes it easier? We want to learn from each other. So anything that you want to share, last chance to talk about telehealth right now.
Hi, Harut. This is Dr. Santiago. Can you hear me?
Yes, I can, Dr. Santiago. Go ahead.
Hi. Yeah, so we use Zoom mostly, and then if a patient is not able to use Zoom for whatever reason, then we use Doximity Video, which is in beta and is now available for both iOS devices and also Android devices. And that works really well because the patient just has to click on a link. We use NextGen, of course, and we are looking at using what's called OTTO, which is NextGen Virtual Visits, and it's incorporated with NextGen. So that might be sort of like something that's in between the two of those, where it gives you this video platform, and patients can access it from a link in the email or from a text message, depending on their preference. But it's still going to be limited, of course, by patients having an applicable browser to use. You know, not all patients have the smartphone or adequate technology, as somebody was saying earlier. but it might be something that most patients can benefit from.
Excellent. Okay, great. Okay. Anything else on telehealth visits that for the better of the group? Okay. So again, one of our ways of kind of mitigating our reduction in patients coming into the center is to really push the use of telehealth. But we also know that, there are some patients who are going to come to the center anyhow, and there are some visits that need to be done in person. So if you can go to the next slide, I just wanted to open it up to, how are we redesigning our operations to accommodate safe on-site visits for those visits that do have to take place on-site, and what are your tactics? We've heard some, but again, we've had a month since the last time we met in QTECH. What has transpired during that time? What are you doing with these visits, including lab visits? I heard something about doing the drive-through, drive-up HbA1c testing. Again, that will speak to your lab services as well as what we're going to speak about next, which is really talking about your clinical measures. So I wanted to open it up for a little bit of sharing on what you are doing at your sites in order to accommodate safe visits for our patients. Anybody want to talk on that?
This is Marty Folsom from Community Health Centers.
Hi, Marty.
I know that within the last couple of weeks that we have started having MAs that are situated at the doorway. And so everyone who comes through the center now, whether they are an employee or a patient, everyone is screened before they come in and, asked to wear a mask and do those things. So they are trying to be very proactive before someone actually comes in. And then also, we've when they're making their appointments with the patients, they are asking them not to bring anyone other than a caregiver if that's needed for pediatrics or for a vulnerable population patient, or a translator if that is something that has to be done. But trying to limit the numbers of people that are coming into the sites. We're also doing curbside delivery now for our pharmacy. The patients can call in and ask for their prescriptions to be ready, and when they get there, they call, and someone from the pharmacy delivers it to their car. So they're trying as many of those tactics as we can to try to keep people from being exposed to other people in the centers, and to keep our employees safe as well.
Any other tactics? I know some of you have segregated your sites, designated certain sites for pediatric services. Anything new since the last time we spoke about this?
This is Felicia at West Y. We did our peds office. We have well in the morning, and then after lunch we have sick visits.
Okay.
And our pediatric office doesn't do any telehealth at all. All patients come in at this time, but we do the same thing, screening at the door at all of our sites. And we have routed all patients who are feeling ill and feel like they're symptomatic of the flu or COVID or anything like that to one clinic where we have an external triage tent that it's set up outside in our parking lot. And we have big tents with walls, and it's a regular exam room with front desk check-in, waiting room, all set up outside external of our clinic.
Okay. All right. Anything else anybody wants to share on your sites and accommodating for safe visits? we can move on to the next slide, which basically now, having said, we're going to try and increase our telehealth visits, accommodate safe visits where we can, how can we mitigate the impact on UDS? So the first thing I wanted to share with you guys, I know there were some questions about self-reported vitals. Definitely we want to get those vitals that we can to inform decisions, to inform, the provider decisions, etc. But those patient-reported vitals cannot be counted for UDS reporting. So for right now, those are not or should not be captured where they can be reported for UDS. I specifically sent communication to HRSA to get clarification, and that is the guidance that was given. But there are some things that we can definitely accomplish during our visits, and I know some centers are doing this. I think in one of our webinar series, I think it was session 3, one of our partners was talking about how they do that, where they have the MAs or the nurses prep the patients before they even see the provider and make sure that all of these things, depression screening questions, tobacco screening questions are already addressed. So is anybody already including that in their workflow that can speak about it? And I know somebody else asked about it earlier also.
At Burlington, we're doing that. We're doing the PHQ-9 over the phone and all the social history, everything. So our workflow hasn't changed. The only thing that we're not able to do, like you said, we cannot put the vitals, but we're documenting the self-reported vitals, but not in the vitals section. We're putting it as a note. Other than that, whatever that we would do while the patient is in office, we are doing those screenings over the phone. The MAs are doing those screenings.
Excellent. Anybody else who's already incorporated doing your depression screenings over the phone, asking the questions prior to handing over to the provider?
Hi, Harut, it's Allison. Yes, we are CHI. The medical assistant does a PHQ and all of the necessary pre-screening documentation prior to the patient getting on the call with a telehealth visit.
Excellent. So yeah, this is, we just have to think about, which measures we can still go ahead and incorporate in our visits currently, even if it's telehealth visits. And definitely these two work quite well with doing a telehealth visit. The other ones that I was thinking are the medication-related measures, such as your IVD and your statin therapy. We can definitely address those. We can definitely run our UDS reports and see which of our patients who've already come in are missing these, and use that list to make sure that if those patients are coming in or are having a telehealth visit, that the reminder for the provider to address that. Those are things that we can definitely do, even with a telehealth visit. Has anybody started doing any of these things? I know it's kind of early and we're still trying to get ourselves situated with telehealth visits, but some of you have started asking for, gap reports. So is anybody looking at this already?
Yes, good afternoon. I'm Sandra Roca from Borinquen. Yes, for IVD and statin therapy, we have especially a list of telehealth that nurses are calling the patient for chronic condition. So we are really focused on the IVD and statin therapy doing in telehealth nursing calls and nursing on corners. Okay. This controlled for medication reconciliation to complete if the patient needs refills or need something else about it. So we are already included this one in the chronic conditions.
Okay, great, excellent. And just, somebody had spoken earlier about, drive-through HbA1cs. So just wanted everybody to kind of think about that, whether it's a drive-through or whether it's, creating a safe solution, a time frame when you're doing labs where whether you're setting aside a certain time where you're just allowing people to do labs and come in one by one, that we can start thinking about those things for, things that we need to do on site, such as, the lab draws for HbA1c. So again, I thank you for, participating and talking about what you have and what you're doing. This is the best way for us to learn from each other. And so I will be passing this on now to Jillian, who will be talk to you a little bit about some of the user guides for some of the telehealth platforms that are most commonly used. And then later on, we will also have Lori, who will be talking about, some of the workflows for a good telehealth visit. So thank you very much. And if there's anything that we can do to assist you, any questions that you have that we can help you with, any topics that you want to hear with respect to UDS or anything else, please do put it in the chat and we can try and include it in our next QTECH meeting. Thank you.
Hi, good afternoon, everyone. My name is Jillian Javed, and I have been with Health Choice Network for a little over 3 years now, and I serve as one of the many wonderful clinical informatics specialists on the system optimization team. So today I'm just going to take a few minutes to go over some of the telehealth user guides that we've created in recent days. So one thing that we learned early on when this pandemic started and we were starting to make all of our changes and you guys were starting to make all of your changes was that everyone was, gravitating towards different platforms. So one of the things that we did, and I say we as HCN, is we kept our ears open and we kept asking questions to really find out what those top platforms were that our centers were gravitating towards so that we could try to quickly develop some user guides to help all of our centers, not only your staff, your providers, your MAs, and your front desk, but also for your patients as well. So just some quick guides to allow them to quickly understand how to download the app, any apps that needed to be creating, any accounts that need to be created, starting up or scheduling one of these visits, launching one of them from the provider side and launching them from the patient side. So we tried to take many different angles at the guides that we did create. So we narrowed it down to 3 for the initial development of these software user guides, and those platforms include Zoom, WhatsApp, and Doxy.me. And what you're seeing here is basically a snapshot. So there's 4 different user guides for each platform. And like I mentioned, there's patient-facing, provider-facing, clinical staff-facing. So there's a little bit of everything for everybody. So hopefully, if any of these can be useful, or if you're using any of these systems, or if you're thinking about using any of these systems, you can quickly come here and grab one of these user guides, disperse them out to your staff, or put them, I heard someone putting it out on your website for your patients to be able to leverage, that you could do that quickly and efficiently using the resources that we've developed. So next slide, I am going to show you quickly. It's super easy if you haven't already been to hcnetwork.org and accessed the COVID-19 resource library. This slide, we're just going to talk about how you can do that, not only for the telehealth user guides that I'm talking about today, but there's so much great information that our entire organization gathers on all things COVID-19, So this is a really great resource, not only for the user guides, but if you haven't come in here and spend some time looking around to see what kind of information is in here, I really encourage you to do that. But if you haven't, so it's super easy to get to. You're going to start by going to hcnetwork.org, which is our main Health Choice Network webpage. Up in the upper right-hand corner of that landing page, you're going to see the COVID-19 Resource Library and that pretty blue button right there. So you'll select that. And then once you get there, you'll go into your first set of folders. And to navigate to the telehealth resource guides, you'll select the telehealth resources folder. And then within that folder, you will see a telehealth software user guides. And that's where all of those 12 documents are currently housed in PDF form. So again, if you are using any of these platforms or you're thinking and exploring what might work for you, this can be a great place to come in and take a look at those guides to see how they can be incorporated into your workflow today or in the future possibly. So we'll go to the next slide. And what I wanted to do was just give you a quick example of what the document looks like. And what we did was we went step by step. We didn't go onto a website and pull something from the system. We actually wanted to walk through the process and make sure that we knew exactly what the patient or the clinician or staff member was going to encounter as they walked through it. So we wanted to make it quick and easy and include those screenshots. So hopefully, if you're sending this out to your patient, it gives them not only the instructions, but it also has the screenshots that we know are up to date because we just did it, last month, and we worked through it ourselves and took these screenshots. So there's not going to be outdated images or outdated instructions, and we really wanted to make it as user-friendly and clear as possible so that if your patients are not as tech-savvy as the rest of us are, at least there's some images that can kind of help guide them through that process and hopefully make it a little less painful and a little easier for you on your end. Maybe you have to field less calls on, hey, how can I get this set up, and maybe make that process a little bit easier. So you're going to get the instructions, you're going to get the screenshots, and some of them are just a few steps, 1, 2, 3, one pager, and it's done. So most of the documents are pretty quick and easy for both the staff and for your patients. All right. Well, that is it for me. Thank you, everybody, and I'm going to hand it over to Michael.
Good afternoon, everybody. My name is Michael Sangili. I've been with the organization for a little over 10 years now. I manage the cybersecurity posture here at HCN. And today we just wanted to talk about a couple of tips and threats to be aware of during these COVID-19/coronavirus times. So first, we're going to cover the big one that's come into our lives. Now everybody is using a video conference system, whether it be Zoom or Doxy.me. So there's several threats to be aware of. Such as Zoom bombing is one. I'll get a little more in-depth detail about that in the next one. But Zoom bombing and just hackers in general just trying to take patient data from these video conference systems that can be outdated. The next one is phishing, and this phishing efforts have been ramped up greatly since this all started, and they're all based around coronavirus/COVID related emails. They use this as clickbait. They know everybody's paying attention to this now. So this is their new theme that they're deploying to all the health centers specifically to try to get everybody to click on this. And healthcare has become the #1 target by far. We always monitor these trends to see what sector is targeted the most. And by far right now, it's healthcare. A lot of these hackers do not have any empathy, and they do not care. They know that this is a time that we're all struggling through, and the last thing we're really trying to focus on is security, because everybody's worried about each other and trying to take care of patients. So they take advantage of this and try to deploy everything from malware to phishing attacks, and hope that while you're not paying too close attention to things, you may fall for this attack so that they can profit off something like this. So on the next slide, I'm going to talk about a couple of tips. Can you go over? Yeah, there you go. So on this slide, we're going to talk about a few tips, a little more in depth. Minimizing risk. So ransomware has become a big malware attack lately. They know that everybody is very busy in their health centers and not paying attention to security. So what they do with ransomware is, like I said, they don't have too much remorse, and they send out malware that is your Zoom and your patient data, and you will not have access to it until you pay some sort of ransom. They'll ask you for Bitcoin or something, and if you do not pay it, they'll keep your files. You won't have access to it. So they're aware of that, and they're trying to deploy that attack. A simple way of just preventing that half the time is just keeping your Windows systems or your Mac systems up to date just by clicking that update button. I know it pops up for a lot of people and it says, would you like to update your Windows? And everybody goes and clicks later, and they never do it. Well, that leaves these loopholes in your system so that they can spread ransomware or any kind of malware or virus through your computer and to other computers. So just by simply keeping your systems up to date and clicking that update button that takes you 10 seconds to click it and runs in the background will just keep you that much more safe from these attacks. The next one for organizations specifically is implementing some sort of security awareness program. Now, what this is just essentially a program that you are consistently running with your organization. Like at HCN, our security awareness program is geared towards phishing and social engineering attacks. And so we typically will phish our own staff with just test phishing samples. They're just fake phishing emails that we send out to our staff without letting them know. If they click on that email, they automatically get enrolled into a course where we teach them on how to spot phishing emails and how to look out for different threats online so they don't fall for this. The importance of this is that everybody is always up to date with the latest threats, and they know when a phishing email comes in, they know how to spot them, and they know how to not fall for them. And that helps keep your entire organization safe. We always say that all these threats start with the end user, because the easiest way for a hacker to get into an organization is really just by sending you a simple email, hoping you click on it and download some type of malware, or hoping you fall for that fake Microsoft or Amazon website that's not a real site. You put in your username and password, and then now they have access to your whole system because you gave them your username and password. So that's the importance of implementing some sort of security awareness program in your organization. Using antivirus in all systems, this is almost a normal thing for everyone. The problem is antivirus, just like your Windows systems, we don't update them all the time. That pop-up comes up, asks you to update it, you say later, and we never update it. Now what happens there is if a new version of a ransomware comes out that your antivirus system has not been updated and does not know about that ransomware, your antivirus system will not be able to help you out in that situation. That ransomware or malware can still infect you even though you have the antivirus system. So even if you have it, make sure you're updating it, because they're constantly updating it themselves with all the latest attacks. And that's how an antivirus works. It's just constantly updating it, letting it know these new attacks that are out. And the last one is staying updated on current threats. I think to everybody in this conference, in this meeting, we send out an email with the latest threats. So that's one way. You could just read our email. We talk about all the threats that are currently out there, whether it be phishing or malware or anything. We talk about any of the latest cybersecurity threats. There's also several sites that you can go to. If you just go to on healthcare websites or any HIPAA related websites, they always talk about the latest phishing threats or malware threats to be aware of. So it's just good to know what's out there so that you can spot it and stay away from it. So video conferencing has become a huge thing now for us, and we're hearing it on the news about all the different threats that can come from it and that we're not aware of, because this is a new thing for us to be using just on a daily basis like this. So the biggest one that we've been hearing on the news is called Zoom bombing threat. It's more of a prank than really something that's going to affect your organization, but it can become a nuisance. Where Zoom bombing is, we're having this conference right now. Somehow somebody got our meeting ID and we didn't lock down this a conference with a password. Now somebody jumps in here and starts making some kind of noise, playing some kind of something in the background, or they can even be malicious and put something in the chat that's a link that can get everybody to click it to go somewhere. So simply by just locking down your video conference with a password will save you a lot of headaches. That's what was happening with the Zoom bombing. Everybody was having these meetings and they were sharing the meeting IDs out. Well, when people take a picture of it or just post it publicly on a forum somewhere on your website, anybody can grab that meeting ID and join that conference and do whatever they like. So always password protect any conference that you're holding. This goes with saying don't share your meeting IDs publicly. Even if you have a password, it still puts you at risk. Don't just put your meeting IDs out there. Share them specifically with the people that are going to be in that meeting, and that's it, because other threats can come with just sharing out a meeting ID. And update your video conference system. Again, Zoom got a lot of slack for some threats that they had, some vulnerabilities they had in their systems. And when you really dig deep into the problem with what that Zoom had, was because a lot of people were using old Zoom systems that were installed on their computers from a year ago, but they never updated it. So that old Zoom system had loopholes and vulnerabilities in them, and hackers found out about this, took advantage, and started siphoning data or joining in on conferences and listening in on people's information throughout these conferences, throughout these video conferences. So just make sure, whether you're using Zoom or Doxy.me or whatever teleconferencing system or telehealth system, make sure you always have it updated, just like you do with all your other devices. So that's our top tips. After this is over, we made a video that shows you our top 5 tips to help secure your home system. Stephanie, are we going to play this now? I know it's a couple minutes long. If you want, you can, but it's only 4 minutes long. This shows. I didn't hear you, Stephanie. Sorry.
No, it's okay. It's a screenshot, but you all will get this in a PDF format after the meeting, and then this is already hyperlinked, so you'll be able to watch the videos there.
Perfect. So essentially what it says here, top 5 tips to secure your home PC. There's just 5 simple things that anybody can do with their home PC. A lot of people are working from home now, or even if it's in your own organization, these 5 simple things will help you secure it and just make you that much safer from any kind of attacks or vulnerabilities. So whenever you get a chance, watch it. It's only a couple minutes. Share it with your organization, friends and family. It's there to help secure anybody's PCs. So we will share that out. We'll also have it hosted on a few of our websites, so you can click it and watch it at any time. That's it for me. If anybody has any questions, I'm here to answer. If not, we'll pass it over to Lori. All right, let's pass it over to Lori.
Thank you, Michael. And thank you, team. Great information, great interactions going on. A lot of good information coming out of this QTECH meeting. My name is Lori Bergen. I am a training and optimization specialist on the training and technical assistance team. I've been with Health Choice Network almost 12 years now. So what I'm going to talk about today is just a couple of things to remember to do when you're having your telehealth workflow. So things to remember. You really want, and I heard somebody else saying this, you want to keep your workflow standard. People don't like change. So keeping things standard, whether the patient is either physically in the office or on a video conference or on the phone. A couple other tips to remember is the appointments themselves. So is the length of the telehealth visit long enough? Usually our centers are scheduling 15-minute follow-up appointments, but is a telehealth visit taking up to 30 minutes? Also making sure that you have telehealth reason codes so that when the appointment is scheduled, it's quickly identified that that patient has a telehealth reason. Another thing to think about as well, during this whole COVID-19, we've had a lot of patients cancel, and we don't want our patients to fall through the cracks. So do we have a cancellation code that is going to separate those patients that all of a sudden in the beginning, 5 weeks ago, 6 weeks ago, we had a mass cancellation of patients, that we can separate those patients from just that the patient canceled or the office canceled, and maybe having a COVID-19 cancellation reason code per se. Great for reporting, to be able to then reach back out to those patients to then get them scheduled for telehealth visit or to get them scheduled for a clean office visit. Next slide, please. So we'll go through a couple of steps. So the way I broke this down is in the pre-visit, what happens before the actual telehealth visit, then what happens during the telehealth visit. So it's always good to have your clinical staff scrub your schedules, whether that patient is coming in to the office or it's a telehealth visit. We always want to make sure who's caring for that patient. So I have a telehealth visit with Dr. Smith, but I also see Dr. Jones for behavioral health, and I also see Nurse Shelley for all of my care coordination. So who is caring for that patient and who really should be part of that telehealth visit? What is that telehealth visit for? Am I going over labs? Am I going over x-rays? Do I actually have those labs and x-rays in the chart? So when the provider is speaking with that patient, it's transparent to them. You know, it's just that they know that that provider is speaking to them one-on-one. They were prepared. We have all this information to make sure that this visit goes well. So if the patient is in coordination with behavioral health, does that patient have a visit on the same day? So can we coordinate that visit to be at that same time? So the behavioral health specialist, if they're all in the office, that they can coordinate that visit. If the care coordination cannot be part of that visit, making sure that there's a note in the chart that that patient does have care coordination going on, and to be in touch with those care coordination staff. Also, remember to look at their screenings. People were talking about the screenings. Absolutely. You can do everything on a telehealth visit as far as screenings go, per se, smoking, depression, as in an office visit or in a telehealth visit. And then it's super important, not only when you're scrubbing these charts, maybe 3 to 5 days out, to actually making those notes in the appointment. So, because those notes are visible to everybody. So the front desk staff could see them, the clinical staff can see them, and the providers that are providing the care for that patient can see them. Next step. So we had our clinical staff scrub our charts. Now we want our front desk to kind of do the same thing. But 2 days prior, I want to, one, call my patients to make sure, confirm that they're coming in for their appointment, or confirm that they're still good for a telehealth visit. Now, when the clinical staff was scrubbing the schedule, they noticed a couple people that are vulnerable patients that really shouldn't be coming into the office. So a note was made in the appointment that maybe they should be switched to a telehealth appointment. At that point, I can speak to that patient about changing their appointment from coming into the office to a telehealth visit. So if this is a new patient, we want to make sure that we're still obtaining all of our registration information, any of our consent, our verbal consent, or any slide information that we possibly could take. We want to make sure that that patient is fully registered, that they understand the link and what type of visit it's going to be, that it's going to be. So if the patient is an elderly patient, they don't have a cell phone, they only have a home phone with no audio, that somebody will be physically calling them, versus somebody who has an Apple or an Android, that this is the link that you're going to go ahead, test it out, make sure that you can get in. Also, when you take the patient's information, very important to make sure to confirm that that is the phone number that we are going to call during the telehealth visit. Make sure they know their date and the time of the appointment, and also let the patient know that, make sure that you're in a quiet setting. They may have 5 or 6 kids. We want to make sure that the provider can give that patient the time. Or if it's for one of those pediatric patients, that the caregiver is with that child and not with all the other kids, to be able to focus on that appointment. Also need to make sure that to let the patients know that to be ready before the appointment, because we will be calling you before the appointment. And very important to a lot of our centers is, does that patient need translation? So who can I have on that call with me? It may be a front desk staff person that's translating for me, or it could be a nurse, or it could be the provider themselves. Same thing goes with our existing patients. We need to make sure that we're running the eligibility. Everything that you are doing today for an on-site visit, we want to make sure that we're repeating that for our telehealth visits. But the important thing here is to walk the patient through what is going to happen and making sure that we have a valid phone number for that telehealth visit. Next slide, please. So the day of the visit. So it's a good idea to have the front desk staff go ahead and call this patient prior to the appointment. We want to make sure that we review the telehealth process with this patient, that they can actually get logged in to the telehealth visit. And then again, remind the patient, are you in a quiet setting? Because we're going to have the MA, contact you, and then we're going to have the provider contact you as well. They can, at that point, obtain any copays or any balances if needed, and then let the patient know, we're going to have our clinical staff give you a call in about 10, 15 minutes and start the visit for you. This is where it comes in, where your events are going to help you out. So if you have an event, you can have an event that telehealth visit that they're ready. I heard on here that West-Y is actually using the care program to notify that this is a telehealth visit. We're happy to help you with any of these things that you'd like to set up. But so the front desk would send a task over to the clinical staff to let them know that they're ready, also using in an event that the telehealth visit is ready. That clinical staff would reach out to the patient. Again, if there was a translator needed, it would have been in the appointment, so that translator is available during that visit. Now the clinical staff will go ahead and they will get the patient logged in, make sure that they can get into the telehealth visit, or again, if they don't have an Android or an Apple, they would just use the home phone. They would obtain all of their travel information, their vitals, any reported vitals, any symptoms that the patient is having, allergies, medications. Very important, those reminders. Smoking, doing the depression screening, obtaining that last A1C, or if the patient has an A1C machine there, to go ahead and take their blood and do their, give you the reading. Also a scale. Patient has a scale at home, go ahead and stand on the scale, let me know what your weight is. And then we would notify the provider that the telehealth visit has started, the patient is in the waiting room, the provider will go ahead and log in, and then the telehealth visit will start for that provider. Not only can you send a task, you can change the event code to say that the patient is ready for the telehealth visit, so indicating for the provider that they can go ahead and log in and start the visit. Next slide, please. And so when the provider is doing the visit, again, same thing with the patient. We want to make sure that our providers have a quiet place to do these visits. We want to make sure that they're documenting fully what they need to do for these patients. Again, whether it's an audio call, we absolutely want to try to push those telehealth audio, or it's a phone call. We want to make sure that they're dropping all of their applicable charges, placing any orders that the patient may need, electronically sending any medications, or if the center has a pharmacy there, sending those prescriptions to the pharmacy in-house and then arranging for that patient to come and pick them up. As well, send a task to the staff to reach out to the patient to schedule any follow-ups needed, whether that is going to be a follow-up in the office if needed or another telehealth visit. And if the patient had a behavioral health visit on the same day, at this point, the providers can switch over from the medical provider to the behavioral health provider to then start their visit. Again, we'd have the same thing to drop their charges, document the visit fully, send any task to their staff to be able to reach out to that patient, see how they're doing, make sure that they can get another telehealth visit scheduled. Next slide. So before I turn it over, I just want to thank everybody for their dedication, their service. We're in this together with you, and please let us know if there's anything that we can do to help. So thank you for joining, and I believe the COVID-19 resources is going to be handled by Stephanie, so I will go ahead and gladly turn it over to Stephanie.
Hi, everyone. So we'll just go quickly over a couple of different resources we have listed here. This slide just highlights some resources provided by the National Association of Community Health Centers. So they've given us a couple different links. One I want to point out in particular is the Noddle Pod that you see listed on the bottom. That's a resource that we found great success with in terms of just information sharing and hearing from other partners nationally and other health centers across the nation. This is just the resource library link, and that's where you would find it if you went through our main website, so that hcnetwork.org website, which Jill explained as well. And we have the link provided in the chat if you'd like to see it from there too. And this is just a shout out for our next COVID-19 webinar. We do have a registration link, so if you pull out your smartphone and scan that QR code that you see on the screen, you'll be able to register for next week's session. So more to come on that. And these are just some other dates to remember and keep in mind in terms of educational opportunities that are out there for telehealth, as well as the dentistry is listed here too. Just another screenshot of those telehealth resources in that folder, and where you can find information like the software user guides that Jill reviewed with us today, as well as other key areas of information for COVID-19. So thank you for joining us today, this afternoon. We'll be in contact, and I hope you have a fantastic rest of your day.
Bye, all.
Bye-bye, thank you.
Goodbye, thank you.